Hi, I'm Terry Schneider from Nurs 210 in Liberty University cohort, and this is Erica, and she's given us permission to do a physical exam on her today, and she is over 18, right?
Yes, ma'am.
So we're going to start with the hair, skin, and nails.
Okay.
And her hair is beautiful, blonde, soft, not coarse at all. Scalp is freely movable. No sign of seborrhea. Any pain when I do this?
Come in.
I'm going to press on the paranasal sinuses. Any pain there?
Come in.
Okay, good. And looking at her skin, she's fair complected, but she looks like she's still got a little bit of tan from that trip she went on. She's got some primary lesions in the form of macules scattered throughout from sun exposure. Her skin is warm and soft, good turgor. No sign of diaphoresis. Skin is the same and symmetrical throughout. She's got a secondary lesion in the form of a tattoo on her foot. Capillary refill to the toes is less than 3 seconds, and to the hand as well. I'm going to ask you to do this, and do that with all the fingers. And the angle is 160. There's no evidence of clubbing there. Okay. And take a look at your ears and your eyebrows here. Continue on. The color of her eyebrows is the same as the color of her hair and the same consistency. Soft, no coarseness noted. Her eyes look symmetrical. The pupils appear to be equal and reactive to light without having used a light thus far. The palpebral fissures are distinct. We're going to palpate the lacrimal sac and the lacrimal duct. No exudate, any pain there? Okay, good. Her nose is symmetrical. I'm going to ask you to look up for me. Take a peek in the inside of your nose. Her inferior turbinates are visible, and the septum is in the midline. Not able to see the superior turbinates. There's no sign of exudates or redness or swelling there. Do you have any drainage from your sinuses?
No.
Very good. Okay. Both ears are similar in shape. The helix responds freely, going back into shape. Here, no pain on the auricle there.
Come in.
I'm going to palpate your lymph nodes now. The pre-auricle, post-auricle, occipital, submandibular, submaxillary, and submental. Any pain there?
Come in.
Okay. Pre-cervical chain, post-cervical chain, deep cervical chain. Any problem there?
Come in.
Okay, good. Can you move your neck back and forth to the left and right for me? Okay. Any problem with the range of motion?
Come in.
And I'm palpating her cervical disc there. And I'm going to go behind and feel the muscles around the vertebrae. And it's all in alignment and symmetrical there. I'm going to ask if you wouldn't mind turning your head to the left for me, and then down towards your shoulder. I'm going to palpate here. Palpating the thyroid, I don't feel any nodules there. And then the opposite way, please. And no nodules on this side. It's all symmetrical. I'm going to take a listen to the thyroid with the bell with the stethoscope. And now breathe. You can breathe. And again, breathe in and hold it. And now breathe and breathe. And go ahead and listen to the carotids. And no sign of bruit on either side of it. Looking at the neck, I don't see any signs of JDD. While the carotids are pulsating, there's no severe swelling there at all. And while we're looking at the lymph nodes, I'm going to look at the supraclavicular lymph nodes as well. And there's no swelling there. If there were any nodules noted, I would note if they were freely moving or fixed. And there's nothing there we can say. So now what we're going to do is take a look at the face and the head. The head is symmetrical and the neck is midline, and there's no problems there. We're going to look at cranial nerve number 5. So I'm going to take this as soft on one end and sharp on the other. This is soft, close your eyes. And this is sharp. So just tell me whether it is soft or sharp, okay?
Soft. Soft. I don't really. Sharp. Soft. Sharp.
Okay, very good. You can So now we're going to check your eyes a little further. We're going to do cranial nerve number 2, which is optic. So first what we're going to do is just take a light and see if your pupils are even reactive. Just look straight ahead. And they're equal and reactive to light. And the corneal reflex is good. We're going to go ahead and do the cover and uncover test, but that would be done if the corneal reflex test, the corneal light reflex was abnormal. Could you cover your right eye, please? Okay. I'm going to ask you to follow my finger, look off to the left, and keep your eye to the left and uncover your eye. Okay, very good. Both eyes converge to the left. That was good. And that was within normal limits. Now, what else would you do with your eyes? We're going to take a look at your eyes with this. We would normally turn this on and have the lights off to check for the red reflex, okay? We do have a good red reflex in there. And we would see the retinal covering back there, which is a creamy yellow, and the optic disc, which is 1.5 millimeters in diameter, and also some arterioles and venials. The arterioles are brighter than the venials, and they are greater in number. Actually it's 3 to 5 ratio for the arterioles to venials, or 2 to 3. Following that, nasally, you would see the optic disc and the physiologic cupping. The optic disc is pink on the outside and white on the inside. There's no signs of glaucomatous changes there. If you move 2 disc widths towards the temporal area, you would see the macula densa, which is avascular and gray in color, and in the center would be the fovea centralis, which is the center of vision there. All right, let's see what else. So we're going to do confrontation now, checking on that. I'll ask you to look straight ahead and cover your right eye. Okay, now I'm going to cover my eye here. This is the bunny. I'm going to ask you to say that you see it by saying now, okay? Just tell me when you see it.
No. 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 No.
Okay. Again.
No. No. No.
Okay, very good. All right, let's see. Now we're going to check your ears. So the first thing we're going to do is, I wanted to mention though about the eyes. I forgot to mention about the Snellen and the Rosenbaum. The Snellen would be for distance vision, and we were not going to do that for this video today, but she would be standing 20 feet away from the chart and be trying to read the smallest line that they could read almost all the way across. And for near vision or reading, that would be the Rosenbaum, that would be held 14 inches away. Now we're going to check hearing, and hearing is cranial nerve number 8, acoustic, and we're going to do bone conduction first with the tuning fork. I want you to tell me if you hear this when I place it on the top of your head, in one ear, both ears, or one or the other. Okay. Now I'm going to put it on your bone behind it, and when it stops. Still going up. I hit it pretty hard. Okay. Okay, do you still hear it now? Okay, tell me when it stops. Okay. Okay, air conduction is greater than bone conduction by ratio of 2 to 1. All right, let's see what else we need to do with you. One of the things that we need to do is checking back with the vision. We're going to be checking the 6 cardinal points of gaze, and we're going to do this with this thing. So I want you to watch it for me. We'll be watching for nystagmus here. She has no sustained points of nystagmus. I'm going to ask you to watch this whole hand. Okay, she did well with that. So she has 2 beats of nystagmus going laterally, and that's within normal limits. And that would be oculomotor, cranial nerve number 3, trochlear, which is cranial nerve number 4, and abducens, cranial nerve number 6. Let's see, what else with your hearing? We're going to look in your ear now, and do you have any pain in this ear at all? Okay. So in her ear, she has a little bit of hair and a tiny bit of cerumen in there. The tympanic membrane is a pearly gray. I am able to visualize the tympanic membrane, the umbo, the malleus, and the manubrium. And the cone of light in the left ear would be at 7 o'clock, and in the right ear would be at 5 o'clock. And those were all within normal limits. So now what we're going to do is check to see, I want to see about your tongue. Are you able to move your tongue back and forth for me? Okay, so that is hypoglossal, and that is cranial nerve number, I'll think about that in a minute. So what we're going to do is I'm going to get some gloves. We're going to look inside her mouth. Well, I had some gloves. I've lost my gloves, so I'm going to pretend I have gloves. Perhaps Erica has some gloves. Thank you. Thank you. We're going to look inside her mouth at the mucous membranes there.
Sorry, they might be small.
That's okay. I normally wear smalls, but these are like our other ones. All right, so we're looking at the frenulum there at the bottom. It's present. Let me look at the top. Relax. It's present on the bottom and the top. Underneath her tongue is well vasculated, and she's got her Wharton's ducts and Stenson's ducts, which is near her second molar, and there's no stones or hard things in there. And I'm sorry. Have you had any problems with ulcers or any problems like that in there? Okay, good. Do you have any problems breathing?
No, ma'am.
How about through either nostril?
No, ma'am.
All right, so what I'm going to ask you to do next is I'm going to ask you to put one side closed and breathe. Everything okay there?
Yes, ma'am.
And check the other side. Very good. No problem with that. So, cranial nerve number 1, olfactory. So we're going to let you smell. So I'm going to ask you to block off one nostril, and we're going to ask you to tell me what this smells like.
Vinegar.
Okay, and then the other side.
Cinnamon.
Okay, very good. Let's see what else. Now we're going to do the test of the sternocleidomastoid muscle here. And can you raise up your shoulders against resistance there? That's very good. And now I'm going to ask you to push on my hand with your face and again on this side. So that would be cranial nerve number 12, and she doesn't have any problems with that. There was one I wanted to go back to, and that is because she has a rise and fall of her uvula. Let me ask you to say "ah" for me. Thank you. And because she can swallow and she has good tongue movement, that it would be cranial nerve number 9, glossopharyngeal, and number 10, which is vagus. So she's demonstrating all of those well. I'm trying to think if I think I missed anything. Let's see. I'm going to check your eyes, check your ears. Okay. Thanks. That's the end of video number 1.